why we worry about Zika is that if the pregnant woman gets infected, she can give it to her baby, and it leads to fetal abnormalities like microcephaly or other neurological disorders or problems with eyes or hearing. So at this time, public health recommends testing only for pregnant women who are at risk. That means that if the pregnant women are traveling to areas where Zika transmission is occurring, and they should be tested when they come back, or if they have partner, like Gary mentioned, because there is a possibility of sexual transmission. If they have a partner who travels to those areas, the pregnant women should get tested also. And we are working with private providers, so we're making sure that the testing is done and possible ultrasounds during the pregnancy are done as well. Now, Zika disease, currently we don't have any vaccine or specific medication that would cure Zika disease, so prevention is absolutely huge. And we actually have a travel clinic here in the South Building, so a recommendation is that anybody who is traveling to areas outside the United States, especially like South America, some areas in Europe and the rest of the world, you don't have to come to a travel clinic, but if you're traveling to Zika transmission areas, you could come to a travel clinic, and we can definitely educate people about the prevention, about which repellents to use, which clothing to use, and so forth. So at this point, I would like to turn it back over to Gary.
We know that you have questions that go beyond the public health response, and so we've asked to be with us today and individuals that you would be able to visit with. Dr. Ari Faraji, who's with the Salt Lake City Mosquito Abatement District, Dr. Andrew Pavia and Dr. Edward Clark with University of Utah. As you know, they're involved in a lot of research around Zika. They are here, can answer some specific one-on-one, on-camera questions for you. Also, Eileen Risk, who's the epidemiologist here at the Salt Lake County Health Department. Dr. Faraji, if you would raise your hand so that they know who you are. Dr. Pavia, Dr. Clark, and Eileen. Thank you. So at this point, we'll allow you to have those one-on-one interviews with individuals you'd like to visit with. Thank you.
Could we get you both to please say and spell your names for us?
Do you want to begin?
Okay, my name is Dr. Dagmar Vitek. I'm the medical director for Salt Lake County Health Department. My first name is D-A-G-M-A-R, last name V as a Victor, I-T-E-K.
Gary Edwards, Executive Director of the Salt Lake County Health Department, G-A-R-Y-E-D-W-A-R-D-S.
Can we ask you a couple of quick questions?
A couple of quick ones, okay?
So we know, we've yet to determine how the Zika infection contributed to the death, but we can say the Zika virus did contribute to the death.
This person had an underlying medical condition, so and tested positive for Zika. So we know it contributed to, but we don't know if there was a sole cause of.
How did the department become aware of the Zika infection?
By our reviewing of death certificates.
So should residents be concerned here that have traveled down in this area, or what should the reaction be here in Salt Lake County or in Utah?
I think the most important, I'm happy actually that you asked it, because the most important thing here is we do not have those mosquitoes in Utah. So there is no local transmission of Zika in the state of Utah. And if you do travel to areas where Zika transmission is occurring, then take precautions. Go to travel clinic, learn about Zika, and make sure that you prevent the mosquito bites.
When you say there's no local transmission, is it because the mosquitoes we have here do not transmit the virus, or the virus isn't here yet?
Ari would be a perfect person to ask, but it's because we do not have those mosquitoes here. Yeah.
How can Zika be, make an underlying condition worse? Or, I mean, can you at least speak to that in general? I know you have to be careful, I guess, with her exact condition, but I mean, how can that contribute to making something worse?
Yeah, I cannot comment on the specific people, but sometimes it can create additional problems for the person.
What happens to a person? I mean, if they get the Zika virus, what usually happens? How do you know?
Okay, could you repeat that question?
What happens to a person when they get the Zika virus? How do they know? What are their...
Okay, as I said, most people are actually asymptomatic. So about 80% of the people, they don't even know they've been infected. We looked at Zika symptoms. People who were infected with Zika, we looked at all the symptoms they get, and the most common ones are the fever, rash, muscle aches, joint aches, and red eyes. So, but I would recommend if you do travel to those areas and you come back and you don't feel well, you're ill, go and see your physician, because it can be something else. It's not that it's only Zika out there. There's numerous other possibilities. So if you don't feel well after travel, you should see your provider.
Do you find it problematic at all that you found out about this case through the death certificate and not immediately when it was known that this person had contracted Zika?
Well, that's always a concern, but the tests did not even come back confirmatory of Zika until after the individual had died. With that, we're going to go ahead and end the general questions, and please feel free to visit with any of the experts who are here. Thank you.